guests coming into the studio right now. It's time for another one of our Astria House calls. Always fun. Find out more about who are the professionals in our community that take care of us. Get to know them a little bit other than in the office setting. So we're about to put one under the hot lights of the microphone, put the grill on, and barbecue us a dock. Wait, no, that's not what we're doing. But I will give you a forecast today. Breezy, 75 right now, under mostly sunny skies, and expect mostly sunny skies the rest of today, all the way through the weekend. In fact, all the way through next Wednesday. The week's worth of weather right now looks to be right around 90 degrees, give or take, either side of 90 over the next 7 days with plenty of sunshine. So another way to put it is, hey, it's July in Yakima. So there you go. 1280 KIT, and House Call continues now with a gentleman who is concerned about your smile, and why wouldn't he be? Gregory Norell, is that how we say it?
Yes, it is.
He is a doctor of dentistry, and particular pediatric dental outreach program at Astria. Young people can be so cruel. They're great, but kids can be so tough on each other. And if a kid doesn't have a conventional smile, or if there's something wrong, man, that can scar you for life for what happens to you as a kid. It's just not fair, just not right, but it's also true, right?
Absolutely, absolutely. See it all the time.
So let's talk a little bit about what you do that maybe concerned parents out there could perk up their ears and say, hey, maybe this is just what we need. So tell us a little bit about this outreach program and how that all works.
Greg Norell. I've been a dentist in the lower Yakima Valley for almost 30 years now. Started my practice back in 2001 in Sunnyside, and then also started a dental outreach program at that time. And I would drive out to rural areas in eastern Washington, set up a little dental clinic, and see the children there.
Nice.
Then drive back, and really enjoyed that. Basically saw a need and filled it like a tooth,
yeah,
I guess you'd say. But then I found Astria Health and saw what they were doing in the lower valley in Yakima with healthcare, and we sort of joined forces together, and I couldn't be happier.
Well, that's excellent. One of the things that makes an impression when you see TV commercials, and I don't know if it's Doctors Without Borders or whatever it is they're talking about, things in other places, and you see kids who get facial improvements, and what a huge impact it has on them, their quality of life. And people should realize that happens right here in the Yakima Valley, and with what you're able to do as a dentist can make such an important difference in a kid's life and self-esteem, and there's just no selling that short, how significant that is through their rest of their life and development. So
absolutely. I mean, dental decay and cavities is the most common childhood disease. They're one of them, and early dental exams are crucial to prevent that painful tooth decay or ensure a healthy smile and speech, chewing. Also, giving them some confidence in themselves. The American Dental Association says we should see the patient about year one, little babies, and it's pretty young for a child, but it sort of establishes their relationship with that dentist, their home dentist, at that point.
That's important. I made a big mistake as a parent. My oldest daughter, Sarah, loved apple juice. And I loved giving her apple juice because it made her so happy.
Most parents do.
And so she would go to bed and just slurp apple juice and then let the juice just sit on her teeth when her teeth were first coming in. It's like, I've ruined my baby's teeth. It was terrible.
Yeah, there's actually a syndrome, they call it now, a baby bottle syndrome. But, hey, we all do it.
And they all fell out, didn't they, Dave?
Eventually.
Your fault.
My fault, yeah, exactly. Well,
we know who to blame now.
The problem was I had to come up with a tooth fairy money, and
there you go.
I set a high standard for that, so that was tough at the time. I had to take out a loan.
It's gone up to $5 a tooth now.
Is that what the going rate is?
The going rate.
Yeah.
I got a quarter.
Yeah, well, I think I got a nickel, so I'm older than you, but I would pull out my brother's teeth just so I could get nickels. What do you want folks to know in general? I mean, our dentists, you can just be like the family dentist, right? Or is you somebody that we need to be referred to come see because of the things that you do particularly? Or
what I'm doing full-time, I'm out of clinical dentistry now, and I'm running Astria Health's Pediatric Dental Outreach Program. And so basically we're bringing preventive dental care to children, directly to the child at a school or daycare, a learning facility, things like that. And we provide a dental screening and oral hygiene or education in a familiar environment, and it's more comfortable for the child. They see their friends getting it, and they're more apt to say, "Oh, this looks like fun. It's not too scary."
I have a scary story to tell.
Oh, there's another one.
It is. I'm sorry, it is. Our dentist in our little small one-horse town, 700 people, was up a creaky wood set of stairs to the second floor of this building. And the minute you open the door, you could start to smell the chemical smell of the dentist office. At each step, this floor wood would creak and creak, and you knew it was like, instead of descending into hell, you were rising up into hell. Because he was an old dude, man. And one time he was giving me a shot, and he kept shooting after he pulled it out, and he like numbed my entire throat. And I just had horror stories about this guy. So if you can get kids in their environment, their world,
absolutely,
calm, peaceful, familiar,
absolutely,
that's the way to do it. So do you have then a staff of dentists there, or you're in touch with other dentists to actually go out and do the dental work after working through your program? Is that how?
What we do, we start the process. An Astria staff member comes out, distributes some permission authorization forms, English and Spanish, and then those are collected after 2 or 3 weeks. Then they're signed by the parent and brought back. And the day of the screening, we come out, and our dental team arrives before school and sets up the dental clinic and in a designated classroom, things like that. And the students are brought in, welcomed. Then they receive the toothbrushing instructions, and we ask them simple questions, about their oral hygiene, like, are you brushing?
Right.
And the younger ones are pretty truthful. The older ones, not so much. And then they receive a dental screening by myself, and then they receive a little dental kit and return quietly back to their classroom. If they have any, something that's alarming, we'll refer them back to their home dentist. But they're to stay with their home dentist. We want to make sure that's established.
Okay. So that helps clarify this in my mind, how this works, is that you're just sort of, I shouldn't say just, you are the hub for them to stay on track with their dental stuff, or to get them started if they haven't. Right.
We're the first line of that type of health care. And, for Yakima, almost a lot of children have a pediatric dentist already, and so we sort of confirm that. You go out to little more remote places, and decay sort of pops up there a little bit.
Sure.
We're checking for signs of decay, beginning decay. Sometimes inflammation of the gums, or even abscess or broken tooth. Then we categorize that. They got cavities. They don't have cavities. They might have cavities, or you need to see your dentist pretty quick. And then the families receive a little report card. We put that in their dental kit, and they're to follow up with their regular dentist if they need anything additional, things like that.
Bottom line is it's really familiarizes and normalizes the process of tooth health as you go about
at a young age. Exactly. So step by step, 0 to 5, then elementary and probably middle school kids is probably as high as we go, out in outreach.
The good oral hygiene, of course, avoids a lot of other health issues.
Absolutely.
That's another thing. Besides becoming comfortable at a young age with the dentist, we're also trying to nip things in the bud. Tooth decay, poor oral hygiene can lead to a lot of other negative problems as you get older. And dental insurance is widely available. I mean, it's required in an Obamacare type plan. Pediatric dental has to be in the plan.
It is.
The Medicaid covers dental care as well. But what about some of the folks with respect to this outreach program who don't have that resource? For whatever reason, they don't have any dental coverage. Where do those kids fall, and how does this program help them?
So Astria has been really, we'll say, generous in that respect. If a child has no, we'll say, primary insurance, we don't bill that insurance. We don't bill the patient. We don't bill the school. We don't bill the parent. Anything like that. If they have Medicaid, we'll take the information and bill Medicaid. But we'll never send a bill to the parent, or let's say their primary insurance, fee-for-service insurance. And if a child has no insurance, it's a visit. They receive a free dental kit, and then we still take care of them, look at them.
Do you try to have a rotating schedule? Do you come back to the same school a year later? Or
yeah, that's a good question. We have a rotating schedule. Our partnerships are our partnerships are very valuable, the community partnerships, and so with those we come back year after year, 6 months or something like that, or once a year, things like that. I mean, our community partnerships have been established over the last 20 years, and they give us the opportunity to deliver the preventive dental care in the schools, and they help coordinate the permission forms and things like that and set up. So with that, they continue to support us year after year. So we have a routine. It's sort of just getting started, though.
Yeah. Well, you're the vanguard, right?
That's right. The unicorn on the block.
That's right.
It's hard to find any hospitals that have dentists, let alone a dental outreach program. So
New Kids on the Block, starring Dr. Norell.
That's right.
Let me ask you this: in terms of our diet, of Yakima County diet and dental health, are we on par with what the national averages are in terms of tooth health and habits?
And I've observed this over the years. Yakima, Lower Yakima, the Basin, places like Wapata or Walla Walla area, and yes, you're definitely. We're definitely on track with Yakima. There's a lot of pediatric dentists. There's a lot of nutrition's good. Decay rates are down from 20 years.
Great.
So, yes, it's definitely improvement. And I would, as a rural community, a large rural community, ag community, I'd put it above most others, in the nation, I guess. Yeah.
Excellent.
So we're doing good.
Well, one of the things that we do see is the braces thing, and on adults and everybody, but the kids with the colorful stuff that used to be, people would run around and not want to show that they had braces, and now it's kind of a point of celebration.
Exactly. They smile bigger than they used to.
Isn't that interesting?
It is. It's more of a, how would you put it, my friends are doing it, and they've got it, and I want it, and there you go.
It's a sign that I'm doing right, and I know my smile's better down the road.
Exactly.
And since we're all in this together.
That's right, we're all in this together. Here's mine. They got blue bands on. Here's mine. They got red bands.
Exactly.
Things like that. So yeah, exactly. Badge of honor.
The first thing that attracted me to my wife, I saw her walking across the street, and she smiled, and I went,
oh, okay.
Oh, my gosh, what a dazzling smile she had. And so...
that was the braces sparkling in the sun.
No, she wasn't wearing braces. But she'd had them earlier, and that's why when our daughter Kate became old enough for braces, or what are those, Invisaligns or whatever?
Invisaligns.
Those things work. Oh, she did that. She too now has just this amazing smile.
Yeah.
And it gives you confidence.
Absolutely.
It improves your look. It's just the way it should be, and in a way that it can be if we get on it early with outreach and get kids doing good, proper dental hygiene and taking care of their teeth for the rest of their lives.
Absolutely. Those primary teeth are there for a reason, and they're to guide those permanent teeth in. And if they're missing, permanent teeth start to shift.
Yeah.
And then... orthodontic treatment is necessary, but, that's sort of the name of the game right now is orthodontic treatment at young ages, so, yeah.
Well, Doctor, we appreciate finding about this. It's kind of exciting to know that this really is something kind of new and different in Astria. Hats off. We're going to talk about you later on with the awards. We're looking at Jane off to the side there. Recent Gold Award winning recognition. So, man, I'm telling you, Astria, Toppenish, Astria, Sunnyside, we got some gold, and not just in our teeth, right here in our neighborhood. So, Gregory Norell, thank you so much for your time this morning. We appreciate it, and we wish you continued success bringing about those great smiles.
Thank you very much. If anybody needs any more information, they can call Astria Health Dental Center in Sunnyside at 509-837-3090. But thank you very much.
Outstanding. We'll be back, 1280 KIT.